Hello, Dr. Pelto here. Welcome to Podiatry Practice Mastery. I'm going to go over today the 5 sales tips every podiatrist should know to 10x their practice profits. Okay, so this is a series of ways to increase your practice by 10x. Just as a backstory, everyone's probably wondering why. You're all curious why I'm wearing this cap. I wasn't just in surgery today. It's a little secret, and I'll tell you at the end of this video. Okay, why I'm wearing this. So number one of these 5 sales tips, one is to teach and not sell. None of us are ever trained to sell. I don't think we learned that in residency. I don't think it's the best way to do it. If you like selling, you can kind of learn how to sell. You can read books on sales. I kind of like to read some books on it, but I think that really the best way is to teach. And when you're talking, the more you can teach, the better patients can understand. I had a patient come in the other day, and they were for a second opinion after a patient had a surgical correction of a hammer toe, right? One of those second hammer toes that was overlapping, that had an ulcer. The patient had a correction. The toe was dorsiflexed more, and it was just not fitting into the shoe. And she said, well, the doctor really never even spoke. They never said anything, and then when there was a complication, they just said go get a second opinion. So I think a lot of times for us, it's important for us to focus on teaching our patients and saying, hey, this is the reason you have plantar fasciitis. This is the reason that orthotics would benefit you. This is the reason that shockwave would benefit you, and taking time to teach. If you're not a natural teacher, I think you'll become one over time, especially when you see the benefit. I find that the best way of teaching, we'll get into with one of the other points, the best way is to use pictures. And so you can either Google pictures or you can develop your own presentation. But the key is when you're seeing patients, you're going to teach them. And if you have a consistent manner of teaching them, then for the most part, it's going to be easier to increase what we call sales, or patients accepting your recommendations. So the second sales tip, number 2, is to offer what's the best for the patient. And this is something that sometimes people get some confusion about this. Let me give you a few examples of the mistakes that I've made in the past. When we're offering what's best, right, you have to do not what's best, for example, based on what they can afford or what you think they can afford. A lot of us, we get hung up in thinking, well, the patients, they have a painful callus and they can't afford an orthotic. Well, an orthotic is probably going to be the best option for them non-surgically to offload it, and that's why it's the best type of treatment. For example, with plantar fasciitis, if there is an effusion and if there's thickness of the fascia on the ultrasound, I think that the best treatment is going to be shockwave. I think it's better even than a cortisone injection. And I also think that over-the-counter orthotics aren't as good and not the best option comparing it to a custom. I think a custom is better. It lasts longer for patients. It can be made specifically for their condition, and so on and so forth. So what you find as the best option is what you're going to be offering to the patient. And that's what I think in the past, what I would always do is I would offer what I think they wanted or what I think they could afford, and things like that. So to increase sales, you would offer them what's best. And part of this offering is you're going to start having patients, they're going to say no. And I think no is a good thing for us. We have to learn how to accept no. I've done a previous kind of episode here where we talk about going for no or getting no's. People not accepting what your recommendation is totally fine. It is something you have to get kind of used to. Okay. So the third sales tip is to use a sales presentation and then including common objections from patients. And this is really the gold standard that I find in my practice, what's really, really helped me. So if you talk about teaching, if you talk about offering what's best for the patient, and if you talk about the sales presentation, which is number 3, I find they all can be kind of included in this one thing. So when you're talking about a sales presentation, I use something called patient presentation. So I am going to show you exactly what this is like. And if you want to get these presentations, you can go to Podiatry Practice Mastery, or you can go to patientpresentations.com. That's probably going to be the easiest, would be patientpresentations.com. And in there, you can just kind of open up and you can get this exact link that I'm giving you right here. Okay. So this is what I like to do for patients. So let me just share it with you here. So this is the patient presentation tool that I've put together. And in it, you're going to see all the diagnoses that I have. I tell you, the ones I use the most are Achilles tendonitis, hallux limitus, nail fungus, and plantar fasciitis. There are others, and I use them occasionally, but these are the ones I use the most. So as I was talking about, when you're talking about teaching patients and offering what's best, this is why I put together these patient presentations. And I would really recommend you using these. It's really made my life a lot easier. In terms of teaching them, we're going to talk about symptoms, what their treatments are, what they can't do as a result of their pain. I'm going to be teaching them. This is my anatomy slide where I talk about plantar fasciitis. I teach why there's tightness in the back of the calf, why there's thickness in the fascia. Here, I also teach why tends to be normal thickness right here, and then a thickened fascia right here. And this explains the reason for plantar fasciitis and treatment for shockwave. So I had a patient, for example, that had done some of the typical treatments. So these are the treatments. And this patient, initially, he was seeing me, and I put him on anti-inflammatories, icing. He did a night splint because he had morning pain. He did home therapy with foam rolling. He did over-the-counter arch supports, things like that. I think he did UFO sandals. I don't remember if he did an orthotic. He may have done an orthotic, but he came back. Now, his symptoms were feeling better at that time. But because of the ultrasound that I did, he understood, and I educated him the importance of doing shockwave to actually reduce the effusion in the area of the plantar fascia on the ultrasound, and he set up the 3 sessions of shockwave. So this is something that is really important, and this is something that I would recommend you using if you're not familiar with the presentations that I do. You can certainly go to patientpresentations.com. You can get access to all of mine. You can use mine. You can make your own, but it takes a lot longer to make your own. But I like to help, and I think those would help you. I'd like you, just if you use them and you like them and they work well, just let me know. Shoot me an email. Okay. So that would be the third sales tip, would be using these patient presentations. Number 4 is using repetition of offers. And so what I mean by that is you want to explain it. You want to use it. You want to use handouts, and then using video. So repetition is key. So let me give you some examples. So if we are talking about orthotics, patients usually, in my experience, they don't accept orthotics, or they don't want to do orthotics the first time. In Massachusetts here, they're not covered by insurance. And so the first visit, I will introduce the idea of orthotics. I'll show them a picture of an orthotic. I am going to give them maybe a handout with something I use called Patient Education Genius. And it's a handout on plantar fasciitis. There's going to talk about orthotics. There's going to be a video that I'm going to send them that's going to talk about orthotics. And then when they come back the second visit, I'm going to reintroduce the idea of orthotics and recommend it if it's necessary for them. And I find that the idea of repeating things many times, so specifically it's mostly for self-pay, and then for AFOs are the things that I tend to repeat quite a bit. So it's not the first time I talk about orthotics that they're going to accept that, not the second. Many times down the road, or something is going to change. So for example, if I'm treating someone for a painful callus that then ulcerates, many times that is what's needed for them to say, okay, well, I think it's time to do the orthotics right now. Same thing with AFOs. Many times I'm offering an AFO to a patient, and they're going to say, oh no, I don't really want it. I don't really want it. But eventually they're going to accept that. And so you really have to be patient when you're offering these, and going for no, I think, is a key. As long as you're doing what's right for the patient and offering what would benefit them. I think repetition, and that's not always repetition by you. So the key is, how can you use a video talking about it, or how can you use another website that you're going to share with them, or a patient handout, or something else that's going to repeat that recommendation in another method. So it doesn't always have to be you. And that kind of goes with the last aspect for sales. I had a patient in today, recently had a stroke on the left side, had some weakness on the left side, and I think he would benefit from the balance braces because he's having some balance issues. So what I did, and this is going to sales tip 5, which is reinforcing your material after the visit. So with different patient resource material. And so what I do with this patient that had the foot drop, he would benefit from, he had more so of a balance issue than he did a foot drop because of the stroke. And so with that, I'm going to recommend balance braces. So what I do is I have this sheet that has information about balance braces and has some strengthening exercises, and I print that off and I give it to him. And I say, well, why don't you think about it? And then what I'm going to do is I'm going to check with your insurance in terms of coverage. And if it's covered, we're going to have you come in to do the casting appointment for those balance braces. Or it could be the same thing if someone has posterior tibial tendon dysfunction with a very flat foot. I'm going to check on coverage of a medial blaze or a Ritchie brace or something else like that. By educating them and giving them, for example, the website for the Ritchie brace, which has a lot of great information on there in terms of for patients, giving them a video that talks about it, giving them a video of a patient that's had that. All these are ways to reinforce it, and it can save you time as a doctor, but as well, it can kind of reinforce what you're talking about. So for example, if you're wanting to do shockwave for a patient or orthotics, you could send them other things to reinforce it. My favorite tool to do that is something called Patient Education Genius. And I want to kind of share my screen as well and kind of how this works. The Patient Education Genius. It ends up being pretty reasonable for patients. It's about $100 per month per provider. The site looks something like this, and you can log into it like I'm doing right now, or you can have it connected directly to your medical record. So this helps me out a lot. Right now, I don't currently do this. I have my scribe doing it, but in the beginning I used to. So for example, if a patient wants to come in and they have Achilles tendonitis, I have an Achilles tendonitis handout, and this is the same handout that we give from the ACFAS website. So it can either be the handout from the actual ACFAS, and you can give them that. So that's kind of the handout. I do have a page on a website that I hand out to them. And then this links to the video that I did on Achilles tendonitis as well. So this is a video. This talks about a little ebook that they can download, which is going to talk about the same treatments. Here's going to be the quick start guide and different types of resources that patients have for this. Okay, so these are a lot of different ways, and then there's a towel stretch type of a thing. So there's different things that you can use to reinforce what you're doing for patients. So I think that was pretty clear in terms of how it is that you can use patient education information to reinforce the sales process. I don't think anyone needs to do a hard sale to patients because we are not doing sales, right? We're offering what's best for the patient. So just to review, tip number one, you want to teach and not sell. Number two, you want to offer what's best for the patient. Number three, and the key that really involves everything, is you want to use some type of a sales presentation. What we used to call this in the past was a script, okay, or a canned spiel, like the way you use it, the way you use it, different examples. A lot of times we're going to talk about different examples when you're talking about plantar fasciitis and other things like that. Repeat things, so they're not going to accept it the first time, first, second, third, and then reinforce it with some type of material that they can go home with. A lot of our patients, they want to think about it. Once again, if you found this beneficial, let me know. Send me an email. If you're on the YouTube page, please subscribe to the channel, and we'll talk to you next time.